So look at this. Pfizer executives have discussed hiking the vaccine price after the pandemic wanes. They basically were caught saying that the pandemic is not going to end. It's going to turn endemic. And when it turns endemic, they're going to make a boatload of money off that vaccine that they made. That is what they were caught saying here. Let me just read you the story, and then we're going to go into the implications of this, because one big question I think many of us should have is, then what the hell is the vaccine? I mean, did you create it with the intention to end COVID, or did you create it with the intention to stall so that you could continue to make more and have it not really cure anything, but just kind of subside some things? And then, like, what is this? What are we doing here? So it says a top executive for Pfizer suggested to investors last week that pricing for its COVID-19 vaccine could increase post-pandemic. So not only are they excited that COVID is going to continue on and on and on forever. That's what endemic is, forever. It'll be here forever. But they're saying they're going to actually hike up the price of the vaccine. The suggestion raises questions about whether a drug developed at the behest of the federal government to respond to a global crisis could turn a profit for one company. The possibility was raised by Carter Lewis Gold, a senior analyst for biopharma equity research at Barclays, during a virtual global healthcare conference hosted by the bank. Gold, referencing comments made by Pfizer executives over the summer, asked how the pharmaceutical company still envisioned pursuing higher pricing as we move from a pandemic to an endemic phase. According to an edited transcript of the conversation, it says, quote, clearly got a lot of focus on the street, and in particular, some of your comments around the potential for higher pricing, Gold said of Pfizer's summer suggestion. I think one of the things that people point to is both the optics of that as well as some of their experience with the flu market. Now, this is absolutely different, but I was hoping you could maybe give us a little bit more depth on your thoughts here and around the potential to pursue higher pricing down the road. So what are you thinking about, pursuing higher prices down the road? Let's hear from you. So in response, Frank A. Diamolo, CFO and Executive VP of Global Supply for Pfizer, said the company anticipates a, quote, significant opportunity for its vaccine from, quote, a pricing perspective as we move, quote, from a pandemic situation to an endemic situation. He says, quote, so if you look at how current demand and current pricing is being driven, it's clearly not being driven by what I'll call normal market conditions, normal market forces. It's really being driven by kind of the pandemic state that we've been in and the needs of governments to really secure doses from the various vaccine suppliers, Diamolo explained. So what I believe, as we move from a pandemic state, from a pandemic situation to an endemic situation, normal market forces, normal market conditions will start to kick in. And factors like efficiency, booster ability, clinical utility will basically become very important. And we view that as, quite frankly, a significant opportunity for our vaccine from a demand perspective, from a pricing perspective, given the clinical profile of our vaccine, he said. So clearly more to come here. But we think as this shifts from pandemic to endemic, we think there's an opportunity here for us. So that is what the Pfizer executive said, and this raises a lot of questions. The first question is, did they ever really think they were going to be curing the disease? Or were they thinking that they were instead going to just continue, maybe they could mitigate the disease a little bit, and then they could then, rather than cure it, maybe they could have come up with a vaccine, maybe, and that would be the real scandal, right? If we found out that later on that all of these big pharma companies that we put so much trust into, we put so much trust into the big pharma companies, big mistake, by the way. Especially all of these anti-establishment progressives for years going after big pharma, saying that they were just all on the take and that they had bought off our government and it was all just a big racket. And then suddenly the pandemic hits and all of them are like, oh, save us, big pharma, save us, big pharma. And now here we go. This is why you could never trust them, because then they come out and say, well, you know what? Yeah, okay, it's a pandemic right now. And so, we're kind of at the behest of these governments. But once it turns into an endemic and it becomes like the flu, we can make money on this like the flu shot. And we can actually put a lot of money, raise up the prices, hike up the cost, because it's not about saving lives. This isn't about ending COVID. This is about opportunity. And so what they're seeing right here, what they're admitting is we got an opportunity with this virus and we're going to go and milk it. And it kind of makes you wonder, and we see this about many, many things. Why is there no cure for cancer? Right? We're able to do so many amazing, innovative things, and yet we don't have a cure for cancer. We also don't have, interestingly, a cure for AIDS. Somebody should ask, many of us are asking these questions, but somebody should ask these researchers and pharmaceutical companies directly. Congress really should be doing that, doing their job, but of course they don't. And they say, they were instead propping these guys up, acting like, oh, our saviors, the big pharma companies, the big saviors of the day. Here they are. They're going to come up with a cure for COVID, and we're all going to have to take it. And we're going to have these vaccine passports as well, because if we want to get back to normal, we're going to have to get the jab, and we're all going to have to do it collectively. This is what we're still hearing in the media. And they basically promoted this nonstop, only to now find out that even the big pharma companies are saying, we don't think this is going to end. In fact, we kind of hope it doesn't, so that we can make a bunch of money off of it. We have no desire to cure it. They have no desire to cure AIDS. They have no desire to cure cancer. And they have no desire to cure COVID. And this is apparent. And anyone who thought otherwise, who thought for some reason Big Pharma was going to be the big savior of the day, unfortunately, I hope this is a bit of a smack in the face. That should have never been the plan ever with this, because we all should have known the writing was on the wall with these big pharma companies. They have shown us who they are time and time again. And suddenly you want to believe there's something different this time. But this time it's different because it's a bad virus that's killing a lot of people. And they're not acting any differently than they are with anything else that kills a lot of people. They see opportunity, they see dollar signs, and they see no problem with hiking up the price of the vaccine once this hits what they call endemic state, which is basically just, we all get over it and realize it isn't going anywhere. And we all just have to live with it. And we all have to come out of our homes. And we all have to start living normally. And there's nothing we can really do. That sheltering in place is not actually going to solve the problem. That this isn't going to go away. And once we reach that point, we'll be in endemic stage. And this will just be here to stay forever as an endemic. Like the flu. It's just here. It comes, it goes, it comes, it goes. We're all used to it. And some people go and they get a shot. And half of America, I think the stat is like 30% to 50% go and get it. And so that is what we're seeing here. So, I think this is, a lot of us should ask, the few key questions on this is, one, did these big pharma companies even attempt to try to actually cure COVID to end it? Did they even try? Was that even really truly on their agenda? Because when this came out, what did we all start hearing immediately? Immediately we started hearing, yeah, but you're still going to have to wear your mask, maybe even 2 or 3. You're still going to have to socially distance. You still can't be around anybody. And it's because you can still spread it even after you get this shot. So because you can still spread it, you're not protecting anyone else. You're only protecting yourself, because this is supposed to help you not feel the effects of the disease if you get it. This is supposed to help mitigate the disease. So it's not really a vaccine as much as it is a medicine. Or, it kind of depends on your definition. They've kind of altered the definition of vaccines over the years. But essentially, they're saying you could still potentially spread it. You're not necessarily safe. And they were saying this thing, and it kind of made a lot of people wonder, like, wait a minute, what were we doing? I thought we were waiting and sheltering in place because you said you were going to come out with a vaccine, and that vaccine would then bring us back to normal. But now you're telling us even with the shot, we can't go back to normal. We still have to do all of these things. Actually, we have to double down. And then you find out that these executives are sitting there saying, what can we do to make a bunch of money off of this? So then you wonder, did they even try to end this virus, to crush the virus, as Nancy Pelosi was saying? We're going to crush COVID. Did they even try to actually crush COVID? Or were they just saying, let's just sort of help a little. And then, by the way, let's roll this out during a time when all the stats show it's already going down. So no matter where or how many jabs they've gotten per population percentage-wise, it's all gone down the same. You look at a country like Israel, which has inoculated nearly 100% of their population, and you look at a country like Portugal, who's inoculated like 10% of their population, and look at their curves, identical in both deaths and spread. And we're seeing this all across the board. It doesn't really matter what the percentage is. It's not correlating with a decline. And so We won't know. We won't know. One thing interesting is we won't know how effective these have been. I think they're probably somewhat. I would think that there is some effectiveness there for sure. We just won't know how much. Really, they're kind of giving us these various different estimates and then they change those. We're kind of hearing this constant fluctuation of estimates changing. And we wouldn't really know unless they did the one thing they're surprisingly not really doing. The one thing to do in order to test whether or not this works is obvious. And that is you go and you start jabbing everybody in the southern hemisphere because they're in the summer right now. So a lot of people are like, well, look at Australia and New Zealand. They're doing great. Well, that's because they've been in their summer and they're all outside enjoying the sunshine. But they're hitting their winter soon. And their winter is our summer. So they're getting into their winter. And when they get into their winter is when they start to see their spread. So it only makes sense, right? South Africa, South America, Australia, these areas, right? New Zealand. It only makes sense that if you want to test and know for sure how effective these really are, you don't go after a population that's already seeing a decline. You go after a population that hasn't hit their wave yet, but you know the wave is coming. So you go after them, right? Oh, but guess what they're doing? Oh, funny. They're saying we can't. Because guess what? Turns out that those southern areas like New Zealand now, they're saying, oh, no, we might have the South African variant. South Africa obviously has a South African variant. So now they're saying, oh, but they are all getting these other variants and our stuff doesn't work on them. So they're not going into those areas and flooding them with jabs when they would need it in advance to stop the wave from coming. So why aren't they doing that? Why aren't they doing that? Well, and I think you could kind of deduce maybe why they're not doing that, but they're not. And then we can wonder why. And then you kind of sit here and you think when you hear that these Pfizer executives are sitting around saying, well, this is going to just keep going and going and going. And when it does, we're going to make a lot of money off of it. Yeah. So, why did anybody ever trust them to begin with on this as to be the key for this ending, to be the key indicator of the key, I guess, to opening up the gates for us getting out of this? Big pharma, the companies that just want to make a bunch of money that won't cure anything that makes them boatloads of cash. And this is just another thing that's included in it. So we won't really know, and again, like I said, I am not at all an anti-vaxxer. I'm not somebody that's saying don't take this. I think this is a very personal decision and you do what you think is best for you and your family. Know the data, know the research, know the reality, and then make a decision for yourself. And so that is what you do. That is what you ultimately do. In my family, grandma's 94 years old, turning 94 this month, got her second jab today. In 2 weeks, we're excited. We get to be together as a family because she, the one who's the most vulnerable, we hope will be protected. At least it's better than nothing. And for us, she's 94 years old. Long-term side effects are not necessarily something she's all that concerned about right now. It's more of like the short-term side effects. So, everybody's got to kind of think about that. But look, when they're sitting here saying you're going to have to keep getting it again and again and again, that this is just essentially going to be a flu shot, then what does that mean exactly? And half of the people, or if not more than half the people, don't even get a flu shot. Why do they not get a flu shot? Because they don't feel like the flu is particularly dangerous for them. And I think for many people, that is exactly how this virus has been as well. Maybe new variants will mean something different for different age groups. We don't know. That would have to, is yet to be seen. Anything can change. Anything can happen. But just wanted to share this with you guys that it's not actually these big pharma companies are doing what they do. And we now have more evidence of that they're doing exactly what they do, which is they're just in it for the money and not actually for the health. And that's the reality of it. All right, coming up next, turns out that the fraudulent media at times, the establishment media, showing themselves once again as fake news. We're going to talk about the retraction, about them misquoting Trump when it comes to the Georgia election. How they were saying he was putting pressure on the Georgia election officials, trying to strong arm them into finding what he wanted And now they're saying, well, okay, that maybe wasn't exactly true. Surprise, surprise. We're going to talk about that. That is coming up.